And hello, Hearts of Oak. Thank you so much for joining us once again. And it is great to have Tony Lyons, head of Sky Horse Publishing, back with us once again. Tony, thanks so much for your time.
Yeah, thanks for having me.
Great to have you. And the last, obviously, people, skyhorsepublishing.com is the website. And a lot of the books will be known, and we delved into the publishing side probably a year ago. Publish 1,000 books a year. Many have been known to us, like The Real Anthony Fauci by RFK, Kiss Unknown by Ed Dowd, past guest, Cywar by Robert and Jill Malone, Sacrifice, How the Deadliest Vaccine in History Toward the Most Vulnerable by Dr. James Thorpe, and we had him a few months ago. Great to hear from him. Dark Eon from Joe Allen, Naomi Wolf, the Pfizer Papers, so many. And even other one that caught my eye was, as a private pilot, was up-to-date federal aviation regulations and aeronautical information manual. That with my geeky hat, I would love to delve into that. And many Christian books, Christian Gospel Zero, Reclaiming the Radical Message on Grace. Really a wide range of books on that, and people can go to the website, delve into that, and many of those books will be familiar to our viewers and, of course, the War Room Posse. But Tony, I'd like to get your thoughts on the politics side. We didn't have any time to touch on that before, and that was well before the presidential election. You were the co-founder of Robert Kennedy's American Values Super PAC. Maybe you want to let us a little bit know how that came about. What was it about RFK's message really that attracted you?
Yeah, I've known Bobby for about 15 years, and I was really taken when I first met him by his honesty and his integrity and his desire to sort of get rid of the corruption in the U.S. government that was harming public health. And, that was true 15 years ago, and it's true now. So he's been really consistent in his desire to do that, and his desire to do the things that he talks about even now, which is to have radical transparency in government, that most things shouldn't be difficult for the public to access. So if there's a clinical trial for a drug, the general public should have the right to go online, go to the CDC website, take a look at that trial, and decide for themselves whether they think this is real science. Versus, the CIA, you can sort of see that you might want to have some privacy there, or some level of not giving the public access. But if it's public health, there's just no excuse whatsoever to keep information from the public. So that's a big part of it, is that he's coming into power in the U.S. as the lead guy in public health, to make that whole process radically transparent so that people can really see what's going on, how the decisions are made, what all the trials look like. So that, I think, is a great development that ought to upset literally nobody. But the amazing thing is the stories that have been coming out almost every day. So I have right here in front of me a New York Times article, one of literally hundreds of New York Times articles that have come out, and the conclusions that they make about Bobby Kennedy and about the great danger that Bobby Kennedy's way of viewing public health might be to the public. It's just fascinating. There was a quote that I'd like to read. So here's a quote from the New York Times. It says, some people may just have to see the harmful impact of the MAHA movement in their own bodies before they realize that they have been misled, and that lots of diseases don't care how well you're eating or how spiritually or morally pure you are. So the point that the New York Times is trying to make is that it's possible, it's theoretically possible, that you could get sick even if you do everything right, even if you work out, even if you eat incredibly healthy foods all the time, even if you're spiritually and morally healthy. So you really have to ask yourself how one of the leading newspapers, one of the most read, one of the 5 most read newspapers in the United States, wants to make the point that it's not important to eat healthy food, that it's not important to be spiritually and morally healthy, that it's not important to try to have an active life. And, that is just shocking. And it should be shocking to anybody. And it shows how the Democratic Party has just absolutely lost its way. That you have a politician, somebody coming into power who's anti-corruption more than anybody in decades in the sphere of public health. And he's really going to fight for the American public, fight for people all around the world. And all of these papers are going after him like he's a criminal. So what's he talking about? He's talking about instituting gold standard science, science that's transparent, science that's thorough, science that's done by independent scientists, not by corporate scientists who are paid to prove that certain products are safe. And there are emails in dozens and dozens of major lawsuits that show that the leadership of these big corporations that our government is entrusting with our science, where they say, we don't pay you as our scientists, as our corporate scientists, we don't pay you to prove that our products are unsafe. We pay you to prove to the government that they're safe. So we're involved in this country in all these public-private partnerships that do not work. They have failed the American public. So when you have every major newspaper in the United States, almost without exception, saying that there's this great risk, and that, as the New York Times wrote in the end of that quote, that they think people are going to have to learn how bad things can get in order to distrust Bobby Kennedy. And I think exactly the opposite is going to happen. That the dangerous things, that the things that we fear most have already happened in the United States. Young children are getting cancers that they never got before. 60% of the public has one chronic disease or more than one chronic disease. People are really suffering. So in a country where the public health establishment over 50 years has spent more money by a factor of 2 or 3 than any country on the planet, and we've achieved these incredibly bad health outcomes, I think that all these newspapers should just be ashamed of themselves, and that the leadership, if it was a private company spending this much money and getting results that are this bad, all these people would be fired. So what's happened is that there's this incredible hunger in this country for somebody who thinks out of the box, for Donald Trump, for Elon Musk, for Bobby Kennedy, who think out of the box, are willing to shake things up, and are willing to end the status quo because the status quo doesn't work for 95% of the population.
I want to pick up on some of those things that are in his in tray. And I've seen those attacks here in the UK. You can imagine if your media are panicking about RFK, our media are just as bad in the UK, and it's across the board. But that clash, I mean, whenever President Trump invited him on the platform, and a huge roar of the crowd, huge excitement. This kind of was the moment that everyone had been hoping for. And it's the biggest nightmare, I guess, for the Democrats, having a Kennedy name on the platform with President Trump. Tell us a little bit about kind of the meltdown the left, especially the Democrat Party, are having since that moment.
Yeah, I mean, I don't think that the left has any sense of what it stands for. Because if you go back to John F. Kennedy or Robert F. Kennedy, you see them talking about things in the way that Republicans now often talk about them. You see them talking about corruption. You see them being anti-war. You see them being for this kind of radical transparency. Kennedy used to talk all the time about um, the dangers of government secrecy. That people have to know what's going on, what their government is doing, or they can't really know what they're voting for. If it's all going on behind closed doors. So I think that the Democratic Party doesn't know what it stands for anymore. And you see that just day after day, that many of the things that they would have stood for 40 years ago or 50 years ago have now become part of the Republican Party platform.
What do you think? He was given the position as Secretary of Health and Human Services, and there was a lot of talk about him maybe in a similar role to Kash Patel, but actually where RFK seems to be exactly where he wanted to be, and Trump sees the huge value he brings in that. Tell us about what that position entails. I mean, half of our viewers will be UK, half will be US. The UK viewers may not really be as certain of what that role will entail and the levers that will be available to RFK to fix some of the problems.
Yeah, so I mean, he's been fighting government corruption in the public health area for the last 40 years. So he's coming in as head of HHS, which is Health and Human Services. So he'll be in charge of the CDC, of the FDA, and so he'll be making public health policy now, and he'll be able to get rid of all the conflicts of interest that have led to kind of fake science. So what we've been told in our newspapers by many of our politicians is that in all kinds of areas, the science is settled. And that is science that's been given to us by the companies who have been poisoning the American public. And they've been hiding things from the public. So they routinely go to the government and ask the government to allow them to hide things from the public for 20 years or 40 years or 65 years. And Bobby Kennedy's not going to let them do that anymore. And then they also ask for liability waivers, so that they can sell a drug to the public that they know is dangerous, that they know isn't properly researched, and they have no liability for it. And so, what those companies claim is that they're doing such an incredible public service that they shouldn't have to deal with any liability. And of course, that's a great line. I mean, that's a line that any big corporation would enjoy making and would enjoy having somebody listen to. But no rational government official would do that because the market really works there. And the way that the market works is that if you create something that hurts the environment and you have liability for it, then you will stop doing that if you have to pay. But if you don't have to pay, if you can dump into a river and nothing happens to you, then you'll keep doing it. If you can poison children and get away with it and make billions and billions of dollars, then there are sadly some people on this planet who will keep doing it, who will do it more and more and more until somebody stops them. And so Bobby Kennedy is the one who's going to stop them. Bobby Kennedy and many other people, because there is, like I said, this incredible hunger for change and this realization, I think, all around the world that we've been lied to by our leaders, and that we've been robbed by our leaders, and that this is the time to take our countries back, to take our government back, to take our public health back, to take our rights back, our freedom. I mean, if you're telling the truth to the public, you don't need the government to censor anything that it disagrees with. You don't need these huge systems for disseminating propaganda, which, many of the people watching this will have seen those kind of mashups on Instagram and various other places where you have 50 different news people saying the same thing on the same day. I mean, there's no question that there's a system in place to try to brainwash people. And if you're being honest, and if you're really doing things that benefit the public, you wouldn't want to do that. You wouldn't feel that you need to do that.
No, I've seen that, and it seems to be there's a concerted attack on the new president. Shock horror at that. But the two areas seem to be the food and the health industry, or big pharma. And I always grew up thinking, as you had mentioned, these companies, they need the protection because they're doing great work. And then you realize they exist for their shareholders. And then you realize actually a lot of the money we saw during COVID, money for the development comes from government. So it seems as though the government pays for this. So the risk is on the taxpayer. The risk doesn't seem to be on the private company. And that's come out more and more. And that means that new revelation, I think, to the public should mean they shouldn't really have any protection. In light of that information, why shouldn't the pharmaceutical industry be treated like any other company, that if they make an error and people suffer, then they should be liable for that? Is it possible to remove that protection? Is that conversation happening?
Yeah, that's definitely something that has to happen. And I think that in most areas that's going to happen, because there's absolutely no justification for it. Because these companies are not suffering. These are not public interest companies. If they were, over all of these years, you would find that people were healthier in the United States than their counterparts in 29 other industrialized countries. But we're at the bottom of the list in category after category. So, the suffering of so many millions of Americans at the hands of these companies that are then getting breaks from our government so that they can make even more money. I mean, during COVID, you had a product. So you had a COVID vaccine that is promoted, marketed, sold by the government on behalf of these companies. They make all the money. They have no liability. We're not allowed to look at their clinical trials. So we have no idea whether they're really safe. We're told stories that they're going to stop transmission, that you're not going to be able to actually get COVID if you take them. Then that story changes. It keeps changing and changing and changing. And there's no accountability whatsoever. So that obviously has to stop. I mean, even during 2008, in the financial crisis, the U.S. government took stakes in a lot of the companies that it bailed out, and then got lots of that money back later. But our government was basically working for these companies so that they could make hundreds of billions of dollars at the expense of public health. And that is crime on a level that I don't think we've ever seen before in history.
And about the health issue, the medical conglomerate. I've seen a joke, and the joke was someone saying, "I need to see a doctor. I'm not feeling well." The American response is, "Well, that'll be $40,000. The UK response is, "That'll be 9 months on a waiting list," and the Canadian response is, "Have you considered suicide?" That's basically, so. There's no criticism from me in the UK, but the cost of healthcare, many people I talk to can no longer afford those monthly deductibles, is that what it's called? And it seems the medical industry exists not to make people well, but just to keep them on products. And this seems to be the first time that a grown-up conversation is being had, and it fits in perfectly to make America healthy again. You need to wean people off drugs that maybe they don't need and are only there to make the businesses money. So this does seem to be the first time a conversation has been had about this.
Yeah, definitely. I mean, it's clear that the big food, big pharma are scared to death of Bobby Kennedy, and they're not scared to death. No rational person is scared to death of Bobby Kennedy because he's going to be dangerous for public health. Once again, all those bad things that could happen, they've already happened. The last 50 years in this country is not a history of public health success. It's a history of failure, that we've had better technology than we've ever had before. We've had better sanitation than we've ever had before. We've spent so much more money than we've ever spent before. And yet we have worse outcomes than we've ever had before. So, there's no success story there. And there's nothing to fear from shaking things up, from radical change. So, this, I think, is going to be an incredible period. It's going to be an incredible test. And I think that many people, on the left primarily, are going to have to see, they expect to see people dying in the streets when we don't just do everything that big pharmaceutical companies tell us to do. And I think that what they're going to see is the opposite of that they're going to see this massive MAHA movement where people are going to eat healthier foods. They're going to demand more choice. They're going to demand that their government not force them to do any medical intervention, that these things haven't helped their health, and they recognize that, and they want to get off that. They want to get outside. They want to be healthy. They want to take a walk, go for a run, go to the gym. That I think this is a massive movement that's going to change the world. And that's what's going to result in better health for people all around the planet, not going to more doctors, taking more pills, taking more vaccines, none of those kinds of things. People 50 years ago took, 5 vaccines, 3 vaccines, 2 vaccines, and, people didn't die in the street. People are in much worse health now than they were then.
You mentioned about the lobbyists, and RFK must be the person they fear because he's against the war machine as well. So he's against all the big interests. And I watched that whenever he was being interrogated, it seemed to be, on the confirmation, and Bernie Sanders was asking him whether he could commit to the Senate that he wouldn't be taking any money from Big Pharma, and Bobby just started laughing and pointed out, "You're one of the biggest beneficiaries." Has that got through? Did the general public see that a lot of the politicians are bought and paid for, and here you have someone who seems to be different and isn't in it for the gravy train? Has that message kind of got through to the public?
Yeah, I mean, I think that a lot of people were kind of shocked at that exchange with Bernie Sanders. It was a really great moment there where Bernie was really saying that what he cared about, what really mattered to him, was access to healthcare, was access to doctors. But it sort of came through that what he's really describing, and that what his fellow Democrats really want, is access to more medication. And these are medications and medical interventions that have harmed people, not helped people. So then when Bobby Kennedy said, "Hey, wait a second, the people standing right here, some of the people sitting here right in front of me, the people who are grilling me, are people who've taken big payouts from pharmaceutical companies." And then Bobby said, "Even you, Bernie Sanders, you've taken $1.9 million. And Bernie Sanders said, "No, no, no, not one penny." And then Bobby said, "Right, not one penny, $1.9 million once again." And then Bernie said, "Yes, but that's in the context of raising $200 million. So in the space of about 45 seconds, he changed his mind from having taken not one penny to, well, it's only $1.9 million. And then it turned out that he's actually taken more than $23 million over the last, 25 or 30 years. So, his brand of bringing healthcare to the masses is actually bringing pharmaceutical drugs to the masses. And that's not what people need. That has failed, to the extent that if you have less access to healthcare in many cases, you might actually be healthier, like the Amish, for example. So, I do think that people, should have access to healthcare, but healthcare in the sense of real health, healthcare in the sense of advice about how to take care of yourself, about transparency about what's in the foods that you eat, what's in the drugs that you're taking, what's in the vaccines that are being shot into your arm on the day of birth, or 3 months after birth, or 1 year later. Because there are all kinds of things in vaccines that people don't know about. So, that's a big part of this whole story, is that people want to say Bobby Kennedy or somebody else, or people who are part of the MAHA movement are anti-vaccine. But the point is that the American public and that people all around the world have a right to know what's in the food they eat, what's in the products that they use in their homes, what's in the vaccines that are shot into their arms. So what it really is that, there's a right to transparency. There's a right to know that there might be toxins in a vaccine. So there's been this concerted effort over many years to sort of make vaccines into a religion, that if you use the word vaccine, which of course you would want to use in as broad a sense as possible, there's this sort of connotation of safety, that's automatically safe. People say vaccines are safe and effective. But, the story is that vaccines have many different things in them. So one vaccine has borax in it. If you put borax into food and give that food to a child, you would go to jail in the United States. But you can put it in a vaccine and shoot it into a child's arm. So that's a problem. That has nothing to do with whether you want to give a vaccine to your child. It has a lot to do with wanting to give borax to a child and wanting to have an alternative to that specific vaccine. And the same was true with the polio vaccine. When a lawyer who is close to Bobby Kennedy discussed one of 6 polio vaccines that people can take in this country, Bobby got hit piece after hit piece that he's against the polio vaccine. He's anti-vaccine once again. In that specific case, first of all, it wasn't even him. But second of all, if it had been him, it's perfectly fine to say anything that we're going to give to our children, we want to make it as healthy as possible. So if we're going to give a pill to our children, we want to know, and we have a right to know, what's in that pill. And often, if you're a big corporation, you're going to put the cheapest possible things into that pill. You're going to put the cheapest possible things into a vaccine with preservatives that make it last for months and months longer. So you're doing things to make a profit that harms people. And people need to have a right to fight against that, to argue that that shouldn't be legal. And that's what's really happening. That's the story there. So the Democratic Party and many of the people who were grilling Bobby, they represent this corruption, which is on the way out. And at some point, I think they're going to start recognizing that they're on the wrong side of history, and that they're going to have to change, or they're going to just lose time after time after time, because people have, wised up now. People are not going to be easy to fool anymore after the last few years. It's become so transparent, and so many, powerful people who've thought things through will never be fooled after this whole period. So, that's what I think the future holds. That's what I think Bobby Kennedy stands for. Just a new way of viewing public health, a new way of viewing politics, and a new possibility for the future.
Tell us about, I've been fascinated with President Trump. I know asked him to look into autism and the rise in that in ADHD, and that will all become part of that conversation. And the first time we've had this grown-up conversation about this. But the issue on food and the FDA, and you kind of think of a free market that kind of lets companies do what they want, and that's meant they've made food as colorful and as addictive as possible. So that hasn't really worked out so well. And I think every time I've been to the US, it's actually difficult to find products that are actually real food, because of how the FDA have the regulations they brought in. And that's one of the benefits. There maybe aren't many, but one of the benefits of living in the UK is the access to food, and the controls that we have. And that is against the big food lobby in the States. I think, did RFK say, give me 2 years, and let me see what can be done? But the food lobbying power, the lobbyists are huge, and that is going to be a massive change to completely redo how the FDA approves. And some of the things you've mentioned, actually, they shouldn't be legal. Tell us to just touch on that work of actually working with the FDA and actually making the food which is on the shelves of supermarkets in America actually healthy again.
Yeah, it is really hard in most parts of this country to find food that is healthy. And food can be medicine, or food can be a terrible, dangerous drug. And the food that we prioritize, that our FDA has allowed on the shelves, all around the country, has been a kind of food that poisons people, that makes people sick. And Bobby Kennedy points out that you go into a McDonald's in London or in Paris or in Rome, and they have 10 ingredients in one product, or 12, and here it's 3 times that. I mean, that the same food by the same companies in Europe has much greater control for safety, that the government there is doing its job, that it's protecting the people of England, France, the Italian people, and the American government hasn't been protecting the people that they're working for. And so, that I think is what we're going to see change. That's what Bobby Kennedy wants to change. That's what I want to change. That's what the MAHA movement is all about. That it's an outrage that there are literally thousands of substances that you can add to food legally in this country that you can't add to food in most other countries on the planet.
We'll see if the media are still angry whenever he tries to make the country healthy again. One thing that really struck me was, I think it might have been the first time RFK was brought on the stage with President Trump, and he talked about that. I think he said for 25 years he started each day with prayer and prayed for God to put him in a position to fix America's health. And his line was, and God answered my prayer by giving me President Trump, which of course did very well to the audience there. But he seems to be a man on a mission. And we in the UK often have individuals in overseeing departments. They have no clue what that department is. They're just given a brief. RFK seems to be someone who understands what has to be done and is a man on a mission. Is that a fair assessment?
That is absolutely right. So, many people want to say that he's not a doctor, he's not a scientist, but he's brought more than 500 lawsuits that involve government agencies and government agency wrongdoing. And so he said this before, that he has a PhD in how the U.S. government agencies work or how they fail. And so he knows all the players, he knows where the bodies are buried, and he knows how to fix it. So the mere fact that you're a doctor or a scientist doesn't mean that you are going to be good at getting to the bottom of a corrupt system and turning it into an honest system that's going to benefit people and improve their health. So Bobby Kennedy is the perfect person, both by his character, his integrity, his honesty, the fact that he sacrificed so much for so many years, has been so consistent. So I think that it's just an incredible thing that he's in this position now. And I really celebrate that. And I believe Bobby when he says that he prayed every day for this opportunity. And that, even though for a while he really wanted to be president, what happened is that he recognized that he could do 90% of the things that he really wanted to do in the role as head of HHS. And I think it's going to actually allow him to focus more on the things that really matter to him. That, children's health has always been at the top of his agenda. He's the founder of Children's Health Defense, which is a nonprofit. It's a 501c3 that works to protect children in all kinds of ways. So, and then he talks about how we have to get to a point where we care about our children, where we want to protect our children, where we want to love our children more than we hate each other. And you see that now with the Democratic Party, that there's still so much hatred. And Donald Trump said last night he could cure cancer. He could do all kinds of incredible things. He could get us out of wars. But there's a big percentage of the U.S. population, mostly Democrats, who would not cheer no matter what he does. So they don't care about their own children. They don't care about ending war. They don't care, that he's really fighting to protect free speech. And they really should. And they should get over their disappointment that they would prefer to have had somebody be president who I think, would likely have been the worst president in U.S. history. But we won't ever know that. But people ought to be open to the fact that Donald Trump may do some terrific things and that he's off to just an incredible start. And the same is true with Bobby Kennedy, that he's coming in there to unwind the most corrupt public health system that we've ever had in this country. Nothing that anybody should celebrate, nothing that anybody should fear being dismantled. And it needs to be dismantled. It needs to be put back together in a way that actually benefits people.
Yeah, it has been a phenomenal, 40 days, however long we're into this. It seems like a lifetime what President Trump has done. I just, one more point, something that struck me about RFK is he seems a very humble person. Realized that actually he was not going to win, didn't keep pushing, didn't keep fighting for that, willing to play the second fiddle to President Trump because he believes certain things need to be done. That's very rare politics, which is about ambition and power, which maybe President Trump echoes more, and that's why he roused the left. Bobby seems to be much milder, much more softly spoken, and isn't it doesn't really have an ego that maybe other people may have. And that's fascinating. I think he will be an example to a new generation that you do things because you want to get it done, not because you want to actually just put money into your bank. That's anyway how I perceive him and his actions over the last year from afar.
Yeah, he is very mild-mannered. He doesn't take things personally. And he really does have a mission that he wants to succeed at, that he's prayed for the opportunity to succeed at, and that I really believe he will succeed at. And I think that there are a lot of people, and I was reading it. It's part of the same New York Times story that I read from before, where they were trying to define the MAHA movement as sort of like a back to the land movement that was based on a fear of technology, a fear of progress. And I've said it before, but it is just a fact that the fear mongering is on the other side, that Bobby is open to anything. He wants to follow real science. He wants to begin to do real science because, there have been major articles in scientific journals that say that as much as half of the science that's been done in the last 20 or 30 years in the US has been corporate funded science meant only to benefit the corporation and help them sell more products to people. And we see the result of that. And the result of that is that more people are sick than ever. So I think that real science, real progress is, easy to see. So if you have a population that is primarily obese, you can't say that Bobby Kennedy or that the MAHA movement is afraid of progress there, or is going to make people less healthy. You would have to show that there's been some success, and there has not been any success. That Dr. Fauci, for example, clearly just failed his way to the top, because his goal wasn't to make people more healthy. His goal was to help big pharmaceutical companies, big food companies, big, companies of all kinds that he had any connection to, maximize profit on their investments. And he wasn't challenged, and he wasn't graded by the impact that he had on Americans, on children. And I don't think anybody can look at the children in the United States and look at the graphs where you have allergies going from here all the way up over a very short period, over 20 years. American children have allergies to so many different things. They have so many more problems, so many more chronic diseases. Doctors, you used to say, Bobby Kennedy mentions this many, many times, that they would see children for an entire year, and maybe they would see one child who had diabetes, or maybe once every 2 years, or even 5 years. And now it's, half the children, more than half the children in certain populations. So, we have an incredible failure. We have very little that we should want to protect, and we should be open to real change. And that's what, that's the opposite of what the New York Times is telling the American public, that he is open to new technology. He's open to new ways of viewing things. And if you have radical transparency, no favoritism of the biggest corporations, then I think you can have an explosion of real science, an explosion of new companies coming up that sell products to the American public that actually make them healthier, that don't have poisons in them, that don't have neurotoxins in them. So, that's how I think science ought to work. That's how I think medicine ought to work. That there should be real competition, and that it's not, sort of like a back to nature versus science and technology and the future. That real science, real technology, and a real beneficial future will come from an openness to a much broader range of thinking, so that it's possible for a small company that has great ideas, that has people who are really thinking out of the box, to succeed, and not just a handful of $200 to $500 billion companies that are favored by the government and that win all the time, that are basically holding us back from the opportunities and the promise of a much more healthy future.
It's exciting times, and just the beginning of this MAHA journey. Tony, I really appreciate you coming on and sharing. You've been a key figure, I'm sure, behind the scenes of bringing Bobby Kennedy to the position he is in now, and one of many great people in the cabinet. And I see Tulsi Gabbard's book behind you, another great individual to that team that President Trump has put around himself. So thank you so much for joining us and giving us a little bit of those insights at the beginning of this 4-year journey that not only Americans are on, but thank God the world is on as well. So Tony, thanks for your time.
Yeah, thanks so much.